Health and welfare is called order, and we also have a set of minutes. Has everybody had a chance to look at them?
All good.
Make a motion to approve.
Second.
Motion and second. That's approved. And we do have one
Vote.
person. Oh, all in favor?
Aye.
There we go. All right, we do have one person for public comment.
I want to ask Special EMA about a location app called What Three Words. And I don't know whether y'all familiar with it. I run into people that have never heard of it. It is a global location thing. The entire world is divided into 10-foot squares. And each 10-foot square has its own discrete three-word locator. I just recently found out that Davidson County and Rutherford County are under this system. And when I found that out, I found out something else that I didn't know, is that the 911 software automatically locates the incoming person, so that person doesn't have to give you their three-word locator. It locates anybody within 10 feet of where they are. Now, being a country boy, I immediately thought about farmers on the back 40 rolling tractors, or hunters or hikers or something give birth. But it also works for people driving down the interstate that have an accident and don't know where they are, or anyone on a back road anywhere that doesn't know where they are. What Three Words will be downloaded for free by the company onto your EMS 911 system. They will later start charging you based on how much use it gets. But like I say, this can locate anybody in the county, anywhere, as long as they have cell phone service. If they don't have cell phone service, they can't call you any report anyway. And you can install it on your systems for free. People can download it to their phones for free. I haven't pulled mine up yet. Which will let me on here. Joe, do you believe it?
I think 911 has a program that does that.
It's the same program.
Yeah.
Then we
What
have
three words?
their Viper, which relays it to us.
That's what it's called.
Okay.
What three words? What three words? Yeah, they have it.
We already have it.
Yes.
Why does nobody know about it? If you've got this life-saving program on your system, why does nobody know about it?
Does the person calling have to have it on their app for it to work with our 911?
I don't think so. I mean, I think the Viper, what he's talking about, at least that's what I've noticed before, that the Viper, when you call in, it pings to where it's at, so it identifies you on the Viper already. So you don't, so in your question, does anybody out there have to know? I think the people that have it in play that are working, they know it, and that's important for them to know, but it's not really important for you to know it.
I'm going to disagree with you, Mr. Mayor.
I'm completely fine.
If I'm on the backside of my farm and roll a tractor, it would be vital to my well-being to know that you could respond to me there.
Well, if you dial 911, they will.
This is something,
I think what he's saying is that from the public standpoint, so say I'm the farmer.
Mhm.
So if I have this app on my phone that I just downloaded, I haven't even opened it yet, and I have this, I open it up and go, my three words are, okay, so our location is Thimble, Scuba, Else. So if I was the farmer and something happened to me, then I could open my app and go Thimble, Scuba, Else and tell 911 that particular location.
Yes.
But I think, cell phones are geolocated already,
Correct.
especially by, so at that point, I think it's kind of double.
Well, that's the thing.
Double coverage,
It's
so-
it's a redundancy program. It
Right.
backs up to, so Verizon can locate you within 3 feet
Right,
of where you're at if you have a strong enough signal and you're triangulating through the towers.
right,
What Three Words is sort of redundant on that. So, like he was saying, if he's on the back 40 somewhere
Right.
and he uses his What Three Words app, when the telecommunicator picks up and says, this is my location, there's no cross streets here, I'm way back in the field, but my What 3 Words app says this, they can look at that and they can actually use that to overlay what they're already seeing and say, yep, that's an exact location.
Right.
I
So
think the other piece to it as well is when you call in and say, I don't know where I'm at, they ask you for your location to verify that what they've got is correct, but they know where you're at when they talk to
My point
you.
is, you know, the people out there on the street don't know that you have this capability. Most of them don't know that this capability exists, and it would be a comforting thing to people out there to know that you can find it.
So what I would suggest, if you go down to 911 and talk to Karen Moore and tell her your thoughts, because she'd be the one that would head that up and get that out there since that's her field. They're outside of us as a government. They don't get taxpayer dollars from us. So, and you know where her office is at?
West Main?
Yes, sir. Yes, sir. I mean, I think it'd be great. So I'm not downplaying it at all, and I'm not familiar with what you're talking about either. So it's an education for me as well. So, but I would go see her and let her talk to you about that. There may be more than we know.
Most of the people out there don't even know that this capability exists.
Yeah, I
And
didn't.
I just think it would be good for people to know that you can do this.
I think from an EMA perspective, I mean, we've got a pretty good social network and social presence. Maybe the PIO could throw something out on socials, just to kind of, highlight the app is that it's out there.
Yeah, I would get with 911 first, just to relay what they have versus
Right.
what we could do. That way it all goes out as one
That makes sense.
piece of information.
You're saying the same thing.
Yeah. Thank you.
I feel better now.
All right. Thank you for coming.
Yeah.
Is that it?
I'm
That
done.
it? All right.
Y'all have fun.
Thank you.
All right, thank you.
Anybody else? So I guess we're going to turn it over to the mayor.
Yes. Well, thank you for coming together tonight for a meeting. And let me tell you a short story if I can. As government is always good about doing, we're always fast about making things happen. And that's a joke. This really started back in March of '23. And Dr. Johns and his wife is here tonight to kind of back up anything I'm telling you. And then, of course, Director Cooper is here as well. But he came to me and he said that, his situation that we've normally had, where he's our medical examiner, and after this meeting, he's still going to be our medical examiner. But his operation was we would give him somewhere around $100,000, and he would take care of all of the people that passed away out there as far as pronouncing them dead. And he had a guy under him by the name of Jay Cook. Some of you may know Jay. Jay came to him, and Jay had 3 people or 4 people that he would send out when he couldn't go out to do the same thing. Jay came to him and said, "Hey, look, I really need a full-time job. This is," and he talked about some personal things, and this is what I need. And so that was going to mess up Dr. Giles' situation. And so he knew that was going to happen. And so he said, "Okay, well, let's go talk and find out what we can do." And he said something to Commissioner Smith, and Commissioner Smith sent him on to me. And so we began to talk about, what could we do. So in that process, we talked back and forth about, okay, the possibility of having someone be at WEMA. Now, the first thing you're going to say, well, that's Jay Cook. Well, and it very well could be Jay Cook. That would be up to Director Cooper if you decide to do that. If he wants to open that position up and publicize it and take applications, and Jay Cook could be that guy. I don't know that and again, it would be back to Director Cooper if you decide to do what I'm going to ask you to do, how he wants to appoint that person. But we would have somebody on staff there to work from 8 to 4:30 every day. And when somebody passed away or whatever, that person would go out and pronounce that person dead. And then that person also does all the paperwork. As you know, they put it in what they call the DD, and there's another.
DD and IMED.
Yeah, so there's two places they put them in, and when they put that information in there, we get so much money back from that for recording that. So that information is important. The other part of the information that's important is that, let's just say grandmama gets out of bed and she's going to the bathroom and she falls and dies at that time. And then, of course, the insurance sometime will say, if they say, hey, grandmama just old age, or the family may say, well, no, she tripped over a rug, it's accidental. So that death pays more on insurance than somebody just died of natural causes. So this person takes care of all those conversations as well that happens. And so if what we're asking is that we put a death investigator with the WEMA organization, take the money that we were giving Dr. Giles and transfer that to WEMA. WEMA will hire a death investigator to work every day and take care of the paperwork and do that. That will be their job. And then at nighttime, he will, and the weekends, he will deputize 3 people that would do that when this person is not on call. If it's a bad case that really needs some expertise, he'll reach out and call the death investigator or reach out and call Dr. Giles if need to be. All the paperwork still goes to the medical examiner to be signed off on. It has to do that, and so Dr. Giles will still work with us. So we said, okay, is that good? Can we do that? So we reached out to several counties around us. Rutherford County was one that's actually already doing that. Kind of talked to them a little bit, and then we went to the county attorney and said, okay, is this a good thing? Is it going to open it up for liability? What's our situation there? Talk through that, and the county attorney can speak for himself, but was good with that and signed off on that. So that is kind of the situation that we've gotten into about how do we go forward. We could change the game and do anything else you want to, but that's the situation that we've kind of ran into. I'll answer, and then we'll answer some questions in a minute. We'll let Dr. Giles talk, or Mike talk, or Joy talk. The money that's in there right now would be enough money in the account that you wouldn't have to put any more money with it. And Dr. Giles had not been really getting a salary since all the money was coming there, what didn't get spent out. If you remember, we upped that a couple of times over the past 6 years. Could be some of that money that was left to him, but what I would suggest is that you give Dr. Giles $1,000 a month, so that's $12,000 for Dr. Giles. And then the salary is somewhere, he checked around about 50, somewhere in the 50s, but 55 is enough left in there. Check with Mr. Maynard. If 55 was right, is there enough left in there to pay for the benefits? And there are, and I have a breakdown on that. Mr. Maynard kind of worked all that out, and I can give you those numbers because Mike is going to ask me for it. $96,698 was the amount of money that's in the line item. If you took out the insurance, which is $11,629, it left you with $85,069. If you took the retirement out, that's $11,203.59, and employee Social Security and Medicare is $6,507.78. That gives you, I'll give you this, and $67,000 is what the total salary is left. So when you take the 12 away from that for Dr. Giles, you get 55. I got it somewhere, my bad. You get 55,000 and some change for that position, and then, and of course, in a couple of years when we get to the pay study, they'll reevaluate that and find somebody and make sure that's even. But according to what Dr. Giles has found so far, in the 50s has been what most people are paying for this position. That's a lot of information, but give me questions.
Question. So what you're talking about is a full-time deputy medical examiner and contracted medical examiner, and then some deputies for weekends, nights, whatever, out of your staff. Is that what you're talking about, with no additional funds?
So if I can get the name, so there's no additional funds needed. Dr. Giles is still the medical examiner.
Correct.
Death investigator was what Director Cooper had coined this, and he also has already drew up a job description and everything for that and the duties of that position. And that person will do more than just that, but that will take quite a bit of his time.
You didn't answer exactly what I was asking.
Yep.
Dr. Giles, a good friend, Dr. Giles, is going to be a contracted medical examiner, $1,000. And then he will have a full-time deputy medical examiner. Is that correct?
He will
Jack
not.
Lewis?
He will not.
He will not be under my jurisdiction. He'll actually be under Director
But that's
Cooper's.
basically that's his function, correct?
Correct.
Okay.
And if I can kind of elaborate, another reason to do this, about a year and a half ago, I was diagnosed with colon cancer. About 6 months ago, I found out that it's stage 4. And although I intend to keep doing this job as long as I'm able, by doing this, there's at least something in place so that, God forbid, I suddenly can't do this job, it doesn't all fall apart. There's already something
Process.
in place so that somebody else can kind of step into my position, and there's already somebody who knows the process to kind of help them along.
Jacob's been doing it for a long time.
He's been doing this probably 20+ years.
Yeah.
I mean, so,
Mr. Chairman, I move we approve it, move forward.
I've just got a question. So I know we have a contract for autopsies, and I think that falls under you, is that right?
No, it's different.
It's
Forensic-
different.
it's different.
Okay.
Forensic contract is with Mike and Aaron.
Okay, all right, so
And
would
anything
that
to do with
have
it.
anything to do, okay, that's what I wanted to know, if it had anything
Not
to do
at
with
all.
this.
So we got a second?
Okay.
I got a question too. What about the three? Are you not gonna compensate them at all?
Well, they'll already be on shift.
They'll be on
And
shift, but they're taking on more responsibility too.
Yeah.
So we're not gonna compensate, them for, doing something extra. That's a lot of paperwork.
So the paperwork's gonna be all done by, the medical investigator,
Okay.
not
So
him, the
you
medical
just-
investigator.
Right.
So all that person he's talking about doing has the authorization to go out there and say, yep, don't pick on you, but,
All right.
yeah, he,
That would be
natural
true.
causes, he
The
turns
guy,
it
the
in.
natural
He
causes,
just
and
gives
then the
it back.
family gets in and says, no, they slipped and fell, then those
That's-
three.
It's out of their hands at that point.
Okay,
Yeah.
all right, that's what I was wanting to know. Okay, that's heavy load,
And
know?
they do some of that now, don't they? I mean, some of your guys do some of that now
Yes.
that Jay doesn't get there.
Yes.
Yeah.
Okay.
And I'm going to assume we're talking about 3 on-duty paramedics that were assigned to do that, and they're gonna basically be on that scene anyway.
Yes.
And they're already gonna be on shift, on staff that day, and they're already responding to that call. That will just give certain ones,
Yeah, basically it'd be 6.
yeah,
We provided.
Okay, because I was gonna say, there's no way
Yes.
that one paramedic's gonna catch all of
no,
it.
no, no.
Mount Jude is wanting to put 3 on their list, which they would, their paperwork and all that would fall under us, since Jay is the one responsible for putting that information in. So just to throw that out there, so y'all would know that.
Commissioner Chandler asked a good question, and I'm assuming, will you have a vehicle this person can go in?
Yes.
Okay. Gotcha.
So I've seen them come up on scenes before in their personal car. I just,
Yeah, he's been driving his
Yeah, I feel
Jeep
sorry
for
for
pretty
him.
much what we
20
Yeah.
years.
For
Yeah.
work. Yeah,
Everybody knows that Jeep.
what I did today.
right. I'm glad to hear he's getting something.
So there's you don't recommend no compensation whatsoever? Because you're gonna have, would you say, something left or?
For,
Address that next year budget.
Yeah,
Let Joe address that next year.
okay,
budget.
all right. I
What we
just-
do-
Yeah, because
what
I'm
we're
going
doing
to
is
address the
formalize-
salary then too, because I've
Okay.
already got it figured through HR
They showed me the
Uh,
personal parts.
on an actual
It's kind of weird sometimes.
you know,
because they don't need to sign it.
rate.
Scale. yeah,
Scale.
Yeah.
And so that'll have to be adjusted next year. So that, yeah, that can all be brought up.
So what you're saying is,
with the new budget.
like we have paramedics, then we have paramedic FTOs. The paramedic field training officers make a little bit smaller salary than the regular paramedics. So this paramedic that's a deputy coroner or deputy DI, they could make.
Yeah, yeah, that's what I'm saying, I've heard, you know what I mean?
And they kind of do that anyway for uncomplicated scenes. I mean, I came back from an overdose, got home, got called by somebody's like, 78-year-old, walked outside, collapsed in his yard.
Mhm.
They've already pretty much made that assessment. I mean,
Right.
yes, he's dead, they're doing their job. And so,
I think anything big,
yeah, anything major.
they'll
then I
call
get called.
whoever,
Okay.
either
Yeah.
Dr. Childs or the other.
Yeah,
What
and
we're
all
doing-
that's defined in that policy
What
thing.
we're doing is formalizing something that's almost in place now.
Right.
And you don't need funds for a vehicle then? If we're gonna give this gentleman a vehicle, or whoever.
Not
is-
currently, that's something we can do with the new budget
He's by itself, isn't he?
later on.
He's by itself.
That's
I mean, yeah, I mean, he gonna, this one person live. There's a lady that had a horse out there was for sale.
That could be entertaining.
If there's one human on this planet that would ride a horse to a death investigation,
It would be
Jacob.
him, yeah.
I would,
Yeah, it would be him.
if I had to.
So on the EMA, we got a motion,
Call the
Second.
question, got a second.
second. Any more questions?
That was
All
it.
in favor on the EMA?
Aye.
Any nays? Motion carries. I guess it's up to y'all.
We need to vote on it also?
I think, yeah.
All right.
Motion.
Motion. Second. All in favor?
Right.
Thank you for this. Dr. Giles brought the conversation up about his medical history, and I wasn't going to do that, but that was another piece of this. And
Yeah, I just want to make sure that, like I say, in the event that something that I don't expect happens, that things will transition smoothly. I don't want to leave the county in the lurch.
We appreciate you.
Yeah, thank you.
Just to reiterate one of your questions, Mayor. Would y'all want me to open that up for applications or appoint one already doing it? I mean, what y'all's, some of that's gonna be up to y'all, I guess.
so
If you don't do it, you might as well just,
from my
this is a
stand,
legal problem.
yeah.
Let him appoint somebody.
Do what now?
Let him appoint somebody.
Well, I think we're going to, and I'll just speak from my own personal view here. I felt like when Dr. Giles came to me, that's kind of what he was asking. But I felt like, and I speak for the public, and I can't create a job for Jay Cook to have insurance. So therefore, Jay Cook is a great candidate and probably will do a great job if he gets it. But if you're going to give this position to Director Cooper, I'm going to leave that to Director Cooper and let him decide how he wants to do that. I wasn't going to ask you to give Jay a job, and I didn't think it was right for me to just create a job for Jay, although Jay is probably the best candidate. And a lot more played into this than Jay needing a job and needing insurance, okay? So that's kind of what started the conversation. So I just want to be clean on all of that, and so I said I'll give it to Director Cooper. If Director Cooper says he's going to post it for 4 days and do Jay Cook, that's what he's hired for.
He's
So
the selecting authority.
yes, sir. So I'm good with whatever you decide to do. If this committee though wants to say, hey, let's do it, that's up to y'all. I'll leave that to y'all.
I think we just give Director Cooper the authority to hire as he sees fit, just like he does with every other position underneath in EMA.
I agree with the appointment because I feel like even if Jay told you today he didn't want that job, I feel like we're going to have a headache on our hands getting somebody trained up and in the, going in the right direction. I feel like this would be the smoothest transition.
Yeah,
And-
that's a niche that's hard to fill.
Exactly.
Honestly.
Yeah, I was gonna say, if somebody wants it for $55,000 and Jay wants it for $55,000, you better jump on him, because them other ones, if you put it out, they're gonna want 100.
Yeah.
They don't want
And they
100.
probably won't do nearly as good job.
That's right.
All righty. Director Cooper, do you have anything for the EMA?
I do.
Any other business?
I do.
Okay.
I guess see what they're doing.
You got anything for us? Cause if not,
No,
I'm leaving.
I have nothing for you.
Yeah, I'm leaving. I don't listen to y'all either.
Before you leave, I got two
Mike, do we
things.
have
All
this?
right, what you got?
Whenever proper time.
Are we staying all together, or y'all adjourning, or how do we do that, Mike?
It's health and welfare. Well, part of it.
Okay.
First of all, let me just share that we have two congressmen coming to the museum next Monday at 9 o'clock to 10:30.
Who?
Two congressmen, Congressman Rose, Congressman Ovals. It's a meet and greet, and if you're a commissioner and the mayor, you should have got an invitation from the Chamber of Commerce here to come to a luncheon and a Q&A at the chamber. You got that, you probably did. But anyway, that invitation's out there. They call the chamber here and let them know to come if they hit you out there. Second thing, some kind of bothers me, and this is for the health and welfare committee. I think it is anyway. I'd be wrong. And Aaron, jump in here. When I throw this out. Most times when you have state contracts, county contracts, you try to renew or rebid them every so often, every 4, 5, 6, 7, 8 years, whatever the case may be. I was a big proponent of getting our county clinic up and going, and we got our county clinic up and going, and there was a deal made where the doctors would take our employees for overflow if the clinic got double scheduled or whatever across town. And there would be a teleconferencing capability between here and his office. Well, as of right now, that doctor living in Texas, not living in Tennessee, I don't know how he holds a Tennessee license, I guess you can do a lot of things. But I think it certainly should be bid out again. Some of the agreements that we had then are just not being fulfilled now, teleconference and that sort of thing. So I think it should be bid out, and Dr. Dow wants to form a group. He's had several of them, Dr. ran the ER for years.
What I need is one more
The
job.
the only thing that I'm real concerned about is we don't change staff over there. It may be a different group, it may be the same group. I don't know how you do it for Texas, but that's neither here nor there. But the staff over there has built relationships with that county employees. The staff does not need to be replaced. It needs to stay in place. Those nurses.
Well, can't we just replace the doctor then?
Well, it's on the contract, is it not? We have a contract.
Contract with resources.
And all I'm saying is I think we ought to bid it back out again and to see what comes in.
This for employees?
It's the employee, Wilson County employees.
I don't know if our
Jerry,
committee.
didn't the insurance committee do that?
I don't know, did it?
I think the
that's an
insurance committee.
Well, I'm injured, I can bring it up.
Yeah.
If that's where you think it needs to go.
Well, I think that's what we did. I'm just
Okay.
thinking back. But
Okay.
I think that's one of the cost-cutting measures we did through the insurance committee, wasn't there?
Yeah,
It was,
yeah,
yeah.
people were really upset with the previous company that was
Right.
running it.
Care here.
Yeah.
Mhm.
And so, anyway, it's one of those things, it is a professional service, and they haven't really raised our per employee per month cost. So, I mean, that's one of the reasons it hadn't been bid out. It's not required to be, but I understand, you know, wanting to take a look at it from time to time, and certainly there are requirements that a doctor review a set percentage of files or whatever, you know. My fear, like it was when we were switching away from care here, what I have always been afraid of is that something in that transition would go wrong, employees would start complaining, and sooner or later you guys would get fed up with the complaints and just pull the plug on the clinic.
Don't need to do that.
Well, I know, but
Don't need to do that.
but I think it would have happened had we gone, had we had another experience when we went to health resource integration, had we had another experience like care here, I think the commissioners would have just thrown their hands up and said it's not working. So that's what I want to avoid. I mean, like you say, everything is running smooth. I don't hear any employee complaints. I don't mean there aren't any. I don't hear any. Unlike when the other group had it, I heard a lot. So I just want to keep the natives from getting restless.
That's my reason to say the staff that's there has built rapport with our patients, which are employees, and that needs to stay in place. You know, like, I mean, sometimes we need to get rid of an employee for something they're doing wrong. I'm not saying that at all, I'm just saying.
No,
Their patient-employee relationship there needs to stay in place.
yeah, and we'll have some attrition, but it doesn't need to be the same. It doesn't need to be like you're seeing a new person every time you walk through
Correct.
the door. Correct.
Commissioner McFarland, I know I was over there the other day, and and I asked about seeing Dr. Wells. And they said, yeah, he'd see me, and they gave me a timing. I said, I thought he left. I thought he went. He said, no, he comes and sees people all the time. And I believe, if I'm right, Dr. Wells' organization is the one that bid this. So you can't keep the people and get rid of the doctor because they're his people. I think it's all one. I think that's who his office bid it.
That's what rebidding would.
So his office bid it. So if they did, somebody else get it, you would be getting rid of everybody because they'd be going with Dr. Wells because that's
that
his
who's got
group.
it now?
That's his group. That's who had it now.
We didn't have to click
Yeah.
it.
And then have you had complaints? Because I haven't had any either.
No, I haven't. But everything that I've ever dealt with, both state, federal, and local, over the years, you rebid it every so often just to keep it clean.
But you hadn't had no complaints either.
No, I hadn't had any complaints at all.
How long have you been with this?
We've been, 10 years now?
Probably 10 years. It's been quite a while. I think we renegotiated the contract one time, but it's something like, and this is close, it's not exact, it's something like $21-22 per employee per month, something like that. But plus, you pay a pass-through on the drugs if they, you know, because I don't know if you guys, the ones of you who are county employees have been over there. When you go over there and they see you, they have a
a room back there in the back where they have antibiotics or you know, standard type medications that they can prescribe and hand out. You don't have to go to the pharmacy and get it filled. So there's some pass-through charges, but basically it's like $22 per employee per month, something like that. And it's been set there pretty much the whole time.
Does our school system get to use it too?
No,
We have
their
a
own-
separate.
They have
They have
We
their
use
own.
premise.
What happened, little history on that, when I was a WEMA director, I walked into the school to check a siren, but didn't work. You laughing at me, Joe,
No.
smacking you. But, down there at.
I love your stories.
I know you do. We put up new sirens, I guess it was middle school, middle school. And
Yes.
there was a shop class, we had it all wired into a big switch box shop class. I walked the shop class and looked around. Looked around, the nurses in there and the bottle of medicine on the wall. And I just, what in the world? You know, well, this is our clinic, 2 bus drivers came in and got treatment there. I said, where's the switch box to make sure the sirens are working? That's where I discovered, thanks to Sheriff Terry Ash at the time. Then we discovered that the schools already had 3, maybe 4 clinics with care here. Had one here and one Mount Juliet, one other somewhere. And so why don't our employees have a clinic? Why don't we have the same type thing for the county employees that the school people have, all their bus drivers and teachers and all that sort of thing? And so that's where this thing has come out of. And this greatest thing since being a butter too, I'm just thinking that from time to time y'all rebid stuff, relook at it, maybe we'll reward them, I don't know.
Where's y'all's clinic at?
The one we have, across the street.
Old Joe.
Oh, yeah.
Gotcha,
Yeah.
very cool.
They got 3 or 4 exam rooms and the drug room in there. If you're county employee, you just make an appointment and go, you
Yeah.
know.
Sometimes
But,
it's
the thing that I'm really concerned about when we look at it, or if we look at it, whatever, is that there are relationships, just like doctors always have with his patients, you know, relationships that need to stay there with the employees. And if the doctor, if somebody else gets a contract and those ladies want to work for that other Dr. Giles' big company, you know, then that's fine too. But that would be their choice, not our choice.
Yeah, but if you ain't got no complaints, so I don't understand why we do it. That's what I'm getting at. That's what I'm sitting there listening to. I don't even know why we're doing it if we ain't got
I
no
hate
complaints.
any complaints, Chris.
Yeah, I don't even know why we're trying to fix it.
Same time.
I think he's wondering if we can get it cheaper from another company.
I doubt you can get it cheaper.
You start messing with stuff like that right there,
I
it
think if
costs
you
you, that's what I'm
rebid it
saying.
for
It'll go up.
Really,
It'll go up.
medical director, take-
Yeah, I think that's what the question is.
Oh, okay,
If the
well, I
medical
mean.
director doesn't live in the state anymore.
It-
But it
okay.
sounds like the mayor said his experience is different, that he's still here.
Up until recently, and I don't know about still, because I don't go to the clinic as much as I used to, but up until recently, he was on every one Friday a month, he was in the clinic all day long, seeing patients.
He,
One Friday a month.
he
Now,
sees
I don't-
patients 1 day a month at the clinic.
Yeah.
And
One day a
he's,
month or week?
1 day a month.
One day a month.
And he teleconferences any day of the week. I teleconference with Dr. Wells Monday, I think,
From Texas?
from Texas.
And
Is that it?
That arrangement may keep the cost down, so.
Mary Janice, if we look at this again, it's insurance, or
Yeah, you take a look at it. I think that's where this contract came out
we
of.
did, we're fine.
And
I
I
thought it came
remember
out
the
health welfare.
school system still got care here.
Yeah.
Well, we split off and went, and I want to say we went with somebody else to start with and then wound up with Health Resource Integration.
No,
It was always Health Resource?
Yeah, Dr. Will's group wanted to start. It was close. There was another practice that was real close.
There was a couple of practices, I think, came in here and
Yeah.
said what they could do, and Dr. Will wound up the contract. And he may very well again, I don't know, I mean, that may be great.
I think that's where it came out of them.
Okay.
Yeah.
All righty. Director Cooper, did you say you had something for EMA?
I do.
All right, sir. We're ready for you.
Health and welfare have to stay in the meeting.
You don't have to, you don't want to.
Well,
You got a motion? You got a motion?
Motion to adjourn?
Second.
Adjourned.
See y'all boys Monday.
What we doing Thursday?
You're welcome.
Next Thursday.
In the morning. Hey, in the morning.
I'm not coming in the morning.
Oh, you ain't?
Tight, you did.
We gonna go with you or?
There may be room at the table now.
Did you get you a
Yeah,
sweet?
Chris.
Because I'm gonna move.
I'm leaving. Yeah, I'm leaving.
My business is over
How
with.
many Titans
See you,
tickets do we
Dan.
get now?
See you, bro.
I ain't going nowhere.
Hey, this looks thick, but you know, it's
Oh,
not.
right, okay, I didn't even see what you was
It
talking
is, but it's not.
Thank you.
You're welcome. All right. Yeah, because I know, 'cause we've got, is this and this?
Yes.
Okay, all right.
Yes.
And then I want to talk about what you and I talked about yesterday. I talked to the
Okay.
mayor since this evening too.
Alright.
So,
Everybody get a packet.
yes.
Oh, we got two over here, didn't get them.
All right, do you guys want to come sit at the table?
Why don't you give us one of those,
Oh, yeah.
flash back?
Yeah,
Thanks, sir.
yeah. There's tables, where there's chairs.
Alright, we'll get going so everybody ain't stuck here. Any questions, just, we'll try to answer.
We'll follow along with you.
All right.
Alright, first one, I think we already talked about, medical examiner. I did put in here, my SOPs for that, position. There's like, I don't know, several pages there of what their roles are, investigations, autopsies, like we talked about. I do have a job description if I need it. We already talked about pay. And what I'm getting in my budget from, medical examiner's office. I got that highlighted. So you can look at that.
Is this gonna be a new line?
Yes.
131? Okay.
Yes.
Okay.
Yeah. Yep. All right, so since that's gone, we'll skip it. And I've got a budget amendment. This is for Homeland Security grant.
Hold on
So-
just a minute, Joe.
Okay,
You're
I'm
gonna
sorry.
need a budget amendment to move this money from under Dr. Giles to WEMA.
Yeah, I've got a note to make that amendment, but I didn't bring it with me tonight.
Well, I mean, but this committee needs to approve it tonight and send it on. don't
Yeah,
they? That's-
well,
that's
I mean,
all I'm saying. We'll get it later.
I thought they did approve it when they approved the 55,000 in change and the 12,000 going to Dr. Giles. I thought they approved it at that
Is that
point.
what you meant?
Okay. I can.
Yeah, I mean, I think what I was thinking that the 12,000 would stay in the same line that it's in now, and that would be a contracted service that you would
So
continue.
you're gonna contract with him?
Yeah,
Okay.
contract service with the
He's like a
12,000.
vendor.
Yeah.
And the rest of the money just go to Joey's budget, and he'll
Right.
put it in the employee line item, and he'll pay it out like he.
Okay, yeah, I'll get that fixed.
All
Do
right,
you want me
So
to make?
did you do a budget amendment or not?
Yep.
Well, I think we
We meant for
did.
that to be a budget amendment?
We need a budget amendment for the.
How about I make a motion? Yeah.
For it to be.
Yeah, I was gonna say, I'll make a motion that this, this document here with the breakdown
Mhm.
be our budget amendment. And I make a motion that we pass this as a budget amendment to go forward to the budget committee.
Jerry, you second it?
I'll take it, sure.
All right,
Any questions?
I have a question.
Yes, sir.
What's the difference in this page and the page underneath? Well, other than the numbers being different?
Well, yeah, that is part of the study that was done on that position. It basically come back in this range right here, but right now, this range is what we're doing, and it will be adjusted, because that's what's in the funds right now. And that's where the 55 come from.
But you're saying that per the pay study, it should be
Yes.
that? Okay, well, we're talking $4,000. I
Yeah.
make a motion that we move, what, 42,
Because it come back
18?
grade
You're
9,
gonna
step
probably have to
1,
Double check my number, but.
and I had to
but-
go.
Yeah, but make a motion that we do 4218 from the general fund into the new 131.
I think
Do we-
y'all making this a lot harder than it needs to be.
Okay,
The intention is to leave 12,000 with Dr. Giles and move the rest of it under Joey, whatever's in that line.
Mhm.
And let the pay study happen when it happens,
Right.
okay? Because
Okay.
that's what your other committee also just approved, that we would not go into any debt any further than what we were. Let's take what we got, make this move happen now, and then when the pay study happens the next time, it
Make the
make that
adjustments,
adjustment,
yeah.
because Dr. Giles had checked around and said 50.
Okay.
50 was actually what he had found in 3 or 4 places, and we're
Yeah,
giving,
this,
we're
Okay.
doing
this is
55.
just like a
Okay.
FYI type thing that I was
Gotcha.
figuring.
Gotcha, okay.
This one gonna wind up,
Alright. There was just a
assuming it
second-
goes through budget and
Yeah.
everything, it's gonna wind
Yeah.
up being a line item transfer, or category.
Right.
transfer.
Right,
Yeah.
Yeah.
yeah, okay. Then
That's
I
yours.
will
Wash
withdraw
it
my
down.
motion.
Well, you already made the motion to do the budget amendment.
Oh, right, well, I did, yes,
Yeah.
but that already passed, I thought.
Not
No.
yet, we're just in
Oh,
discussion.
I apologize. then.
That's okay.
Yes.
Yeah, you still got it.
Back to the
we
original
had a-
motion for the
Basically, the
55,000.
salary
So we got a motion
yes.
and a second.
That we-
Any more questions?
that we said.
All in favor?
Aye.
Any nays? Motion carried.
Mhm.
Perfect.
I'm sorry, Joey, I interrupted.
It's, just past the job description for the project. Oh, no, you're fine.
Oh, yeah,
Yeah, those are just, go ahead. and turn.
okay.
All
Gotcha.
right, turn over to the budget amendment. This is Homeland Security annual pass-through that we do, and if you'll turn the page, you'll see what it's for. It's all for Wilson County, mostly the Sheriff's Department, on equipment that they're getting. We have to show that now, the breakdown of the monies, and we have that there, so requesting that this be approved.
Entertain a motion?
We'll move.
Second?
All right.
Second?
Second.
I thought you were
Any more,
Yeah.
any
I
more
thought you were
discussion?
seconding too.
I can. No discussion? All in favor?
Aye.
Any nays? Motion carries.
Alright, after them 2 pages, I have a lot of medical supplies that I would like to surplus for sale on Gov Deals.
Motion to approve.
Any questions? All in favor?
Aye.
Any nays? Motion carries.
I have a few contracts that we have to run through now. Aaron, I think, is familiar with some of them. None of this one will not need funding. We have it now. It's through Lexapo, and it actually is related to EMS grants. That they will let us know when any grants come out for EMS equipment and stuff like that.
Oh, nice.
So it's an automatic grant finder that they do, and then they relay the information to us. So that's the first 2 pages there, is that one.
And this doesn't cost us any money?
No.
Well, it doesn't
Well,
require any additional money.
Right, it does cost
Okay.
money, but
Okay.
not
Yeah.
any additional.
I got you.
What does that cost?
Do you,
I was looking to see if I could see it in here real quick. It,
Sounds like it's well worth quality.
yeah.
just trying to see if I got that one here.
No, they give us a lot of information about the company and a little bit of information on the back about the term and such, but this particular page, or what we have here doesn't say what the fee is.
Gives you the late fee.
Yeah, it gives you the late fee.
It's not very helpful. So, I make a motion that we continue and enter into this contract.
Second.
You don't gonna enter a contract without knowing the fee for it?
Well, it sounds like we've already done, it's already been done, right?
I don't know, doesn't matter. Just need a resolution.
Yes.
Yeah.
Hey,
Yeah.
hey, I'm gonna put you on speaker a second, okay? Hey, Brian.
Yeah.
Hey, the Lexapo contract, what is the annual fee on that?
$750.
$750?
Okay.
Okay.
I'll stand by my
Uh,
motion
I'm gonna
first.
double my second.
All right,
Yeah.
stay on here a minute.
Any more questions?
No,
All in favor?
that's it.
Aye.
Any nays? Motion carries.
Okay, the next contract, now, if you remember, it was either last year or the year before, we went to a scheduling program.
Correct.
That, so there's a better program that's out there that we're switching to. So this,
The one that we're looking at has more modules to it, where the one we got only does scheduling, and it don't do some of the features that they told us initially it would do. and this one does those plus a lot more than the other program did. So the other contract will just expire. We don't have to renew it, and then this one's one we can continue to renew. It's not an auto renewal, but we can continue to renew as we need to, or desire to.
And it's a little bit less than what we're paying now,
That's correct.
which will pay for the first one.
Okay, super.
So,
Okay.
Is it Goodman, is that the Brad Goodman? Is that the
yes,
one? Okay.
yes, that's the second one.
I make a motion, we enter into this contract at the cost of $89.7750. It's on the last page.
Yeah.
Yeah, it's on the, it's number
Yeah.
bullet 21 on page 5.
Yeah.
Hey, Brian, it looks like the term, it says the cost for 12-month term from 9/1/23 to 8/31/24 is $89,750. I'm sure there's options to renew or whatever, but I don't see anything.
I think it's the very last sentence maybe in that contract, if I remember correctly, Aaron.
For 1 year, same, we'll have the option to renew at the end of the service term. So basically, this is basically a year to year for as long as you want to do it, more or less.
That's correct. Yeah, it's not an auto renewal, and it's not something that's you're committed to for 5 years or anything like that.
All right. This one then is odd because is the one for $750 we have to approve because it's got a term. It's got a set term with an extension. This one being open ended, oddly enough, doesn't fall under the GASB 96 or 87 criteria.
Yeah,
So
it's not a Sabita.
yeah,
I wasn't sure how that worked, so
That's me, over
yeah.
here.
we just
Yeah.
thought we'd bring
I
it
like
up.
that.
No resolution on this?
We don't have to have a resolution on
That's all I
this.
need to hear.
All right, sorry.
That's fine.
All right.
Keep me
Still gotta
focused.
approve it. Lauren made a motion.
Second. We got a
Yeah.
motion. So any further questions? All in favor?
Aye.
Any nays? Motion carries.
All right, I think that's it, Brian.
Okay.
Hey, thank you. Yep. He's camping. I didn't want to call him, but I had to answer his question.
Well, where's the cabin? We'll go visit.
Yeah. Where was he going?
You probably don't want to say that.
Must have been
I
serious.
can't remember.
He'd get visitors probably.
Probably. All right, the next one is an interlocal agreement between the Sheriff's Department and 911. And the co-location that we're going to at the Sheriff's Department. So, we'll bring mine through here. Sheriff's is gonna take his through his, and 911's gonna take theirs through theirs. So this is the first step of this, is here. But everybody, all parties have looked at it and have confirmed and okay with it. So I wanted to throw that out there. So with that, I'm just asking, I guess, for approval in this agreement.
You'll have all dispatchers in one room, so you'll have multi-dispatch capabilities. If I can't get the phone for a wreck, take me here to get the phone
Yeah.
and keep things moving. This is the best thing we've done ever, in my opinion.
Oh,
Yes,
yeah.
it is.
And it's a tornado-proof room, if you haven't seen it.
I haven't seen it, but.
Oh, it's pretty amazing. If you get a
This
chance
has
to
kind
go
of been
over
on the
there.
agenda for several years, and we're finally able to get to this point that will be better on our citizens, yes.
But you still have a backup at your,
Yes.
the old jail,
Yes.
that's just to go down, and you read the lightning strike around the threat. So you got the redundancy built in.
Correct.
Those dispatchers keep working. Ready to approve, sir.
Is there any cost associated with this?
No more
We
than
don't
we-
need.
Yeah.
No.
Yeah,
No.
we already,
Any other questions? All in favor?
aye.
Any nays? Motion carries.
This will show back up after it goes through law enforcement, 911, back to the county commission for ultimate approval.
Okay.
This is a good thing. I
Yeah.
agree with Commissioner McFarland.
All right, last one, another contract. This is the Firehouse Subs grant. It is 100% paid. And we're getting a new, what is it? Hang on.
QuantiFit 2 test machine and
That's
accessories.
it, yep.
What is that?
It's a,
Out of curiosity.
it's for our mask.
Oh, okay.
You have to fit test
Oh, yeah, oh,
for all
okay.
those.
Oh, gotcha. Okay, his is
And,
very happy then.
And right now, we not rent, but we let Lebanon Fire use it. We let West Wilson Utility District use it. So it's got some age on it, the one we got now. So it's wearing down. We've had it a pretty good while, so we turned in to try to get one through here. And I
This
guess
is the thing that looks like a mannequin, right? That you, no.
no, it's
Okay.
just got different face pieces, and you got to do different things with it just to make sure it don't leak and all this
Gotcha.
kind of
So-
stuff.
Same thing though.
Yeah.
This will really be a budget amendment as well. You'll be approving the receipt of the funds, which we will do as a budget amendment, and then I guess the expenditure of the funds.
Yes.
What they'll probably do, I don't know if they're gonna
That's-
give you the money or if they're just gonna straight send you the.
I think there's
fit test
options.
machines. Yeah.
I move to approve that.
Yeah.
Any other questions? All in favor?
Aye.
Any nays? Motion carried.
Yeah, because the price and all that's on here too
Yeah.
for you.
I'm not for it.
You all, is that all you got, George?
That's all I got, yes.
All right. Anybody got anything else? We got any old or new business?
I do. I've got something. So I'm sure you all know my district got hit by a microburst over the weekend, which wasn't a tornado, but it really looks like a tornado. And because it was such a small area, of course, it's not a federally called disaster. And this is not the first storm this season that we've had the same kind of situation in different areas where it's a significant storm, again, not federal disaster, and we don't have any way to help our citizens. So the biggest problem that I'm having right now, and this is the same issue that I had when my district actually got hit by a tornado in December of 21, is debris removal. I've talked to the mayor, so we may actually have a possibility to work this out, but I wanted to bring it up publicly anyway so we could start talking about this. But a lot of times if you have big trees that fall, if they don't fall and hit your house, then your insurance doesn't cover it.
Right.
So we've got some volunteer organizations and some churches and folks who will come out and help citizens actually, cut things up. And, some of them you could actually do burn piles with, but some of it is, it's significant pieces of, limbs and things that it would take forever to burn. We don't have a way to be able to dispose of it. And I've spent my week trying to help these people we have issues like, I have folks who want to take it to the dump, so you can't take any of this stuff to the convenience centers because of fire and safety issues. So I had conversations with Cindy about the possibility of maybe could we open the dump for a Saturday or two to be able to allow access, and she was not sure if she could get staff set up for that. So I kind of hit a dead end there. I had a conversation with West Wilson Utility District, and they actually have a burn site right off of Saundersville, which is right in my district, and said, sure, we could, if you'll bring the stuff, or have people bring the stuff, then we could do a controlled burn. But the idea was to be able to do joint with EMA. So that way EMA could actually, keep an eye on the burn, and they would use their site. Well, I know Joey and Jeremy spent a good afternoon and probably part of a morning going through regulations for me to see what would have to happen to make this occur, and got to the point that there was so much red tape and so many permits they'd have to actually try to file for to have a county sponsored burn that it made it not a solution. We don't have chippers, we don't have access to anything like that. So I guess I'm kind of thrown out there is, can we work together to try to come up with a last ditch in these smaller storms, when we're talking significant damage, to try to figure out a way to help our citizens with just debris removal, not other parts of the puzzle, just I have this entire 200-year-old tree that fell in my yard, and my neighbors came over and helped me cut it up, but now I don't know what to do with it. So
I think that's something we need to ask the road department.
Do they
I
have
know
a chipper?
Steve helped before some if they bring it to the road,
Yeah, well.
but he's gonna be overwhelmed with that.
I won't speak for Steve, but I'm pretty confident that exactly what Steve would say, which is, you know, he doesn't want anything brought into the right of way. He's against that altogether. So that's an issue there. It's certainly one of the first things we thought of, but the fear is if you start telling people to bring stuff in the right of way, there's no end to what people will bring and put into the right of way.
Okay. And I
Yeah.
have had conversations in the past, and that was one of the things that I hit with the tornado before, was that the road commission does take care of things that happen in the easements
Yeah.
and things that are on the road. But if something falls in somebody's yard, even if they drag it into the easement, it's not something that the road
Yeah.
commission is in a position
Right.
to be able to take care
Yeah,
of.
it's gonna be rough on
Yeah, in his defense,
So-
you're talking about a city that's 50 square miles. The county is 582 square miles. I mean,
Right.
that's a lot of ground to cover.
But you just talking about.
I mean, I know,
like a
I'm
tornado
just
type.
I'm
Oh,
just
yeah.
saying,
Yeah.
once
Yeah.
you say.
Not all the time.
No.
but- yeah.
Right.
No, this is an emergency situation. So,
Yeah.
I mean, it may be one of those things where we have, you know, like this year, I mean, I can think of 2 or 3 different situations where this has come up this year. Now, next year, we may not have it at all. It all depends. And I'm also talking about situations that are not federally declared disasters. So, you know, so you're not, if we have another big tornado, God forbid, but if we did, this wouldn't be a problem because we have federal funding with FEMA. We can contract out and be able to take care of this issue. It's just with these smaller disasters. I don't know what else to call them really. It's, you know, and if people live in the cities, they have public works departments. So like, you know, with the city of Mount Juliet, when they got hit 2 weeks ago, you know, their public works department came out and took care of all of the debris for people. You know, people just put it out on the side of the road and then they trucked it away and took care of it. And I think the city of Lebanon operates basically the same, but we don't have a public works department for the county. So we don't have that option. So I just want to work together and see if we can come up with an idea to be able to have this as a service to our citizens in an emergency situation. And I don't know the answer. You know, like I said, I've batted some ideas back and forth with several different departments. I don't know if the
As
idea
far as
is-
the burning stuff, I mean, I live in the county and I'll call and get a burning permit and I don't never have any problems. Can't you?
You-
They can do that in the county, right?
You
I
can,
mean, I can.
but I mean, like you live on 6 or 8 acres, right?
Right, but still.
Yeah. So we're talking about, you know, some people who live in actual, you know, like Cedar Creek
Well, you're
Village.
talking about burning stuff. I mean,
So,
yeah.
well, I mean, I'm talking about stuff that you can't burn. So we're
Yeah.
talking about like big trees that would take years to burn.
No, you can't burn them.
Yeah, or neighborhoods that are actually in the county that don't, they're not, I mean, you're not in a situation where you could actually have a burn pile because you live so close to everybody else. So, you know, I mean, for folks that, you know, like you know, I mean, I've got an acre and a half. I mean, I can burn in my backyard too. So it doesn't even really, I mean, it would affect me some if it was a big tree, but you know, smaller stuff I can take care of. But we're talking about like when, actually I do have some pictures, but I mean, we're talking about like people lost like 8 and 9 trees in their yard. And, you know, some of them were, you know, 3 and 4 feet in diameter. And I mean, the entire tree, like we had one that the entire tree just kind of fell over, and the root ball was probably 12 to 15 feet in diameter, just sticking up in the air. Oh, it was unbelievable, and it came through so quickly, and there was no warning. But of course, you can't warn with a microburst like this. And you know, if you haven't driven through, it was real quick and real local.
So I've had a situation similar. It happened at my wife's uncle's house
Yeah.
in Nashville on Central Pike. He had I guess 100-year-old walnut tree.
Okay.
Knocked it over. I think it destroyed a shed or something. There are woodworkers and wood turners that will make stuff out of wood.
Augers.
Okay.
That they'll come and, I don't know if they'll take a whole tree.
Right.
They'll come and take your big pieces of wood that they can then turn into art. And I know that's not going to be a solution for everybody, but
It's something.
we could get if we could get, hey, these people are looking for free wood,
Yeah, if we could put
they'll
together a
come
list.
get some of it.
Yeah, that would
I
help.
know that's not a government solution,
It's something.
but it's something that they could at least get rid of some of it.
Right.
Because he made a beautiful bowl. This particular person made a beautiful bowl and actually gave it back to my wife's family for their giving them
Oh,
the
wow.
wood. And of course he's made, I don't know what all out of it. He's been able
Right.
to make money off of this tree that
Okay.
was destroyed in a storm. So,
Well, that's a good idea. So, anyway, I don't necessarily have a direct solution. I have some ideas. I spoke to the mayor this evening before this meeting. I think he was going to see what he could do with a couple of different possibilities. If he doesn't get anywhere, then maybe we can go back and revisit. I know Joey and Jeremy and I were talking about the possibility of even entertaining a small line item where we'd put, $50,000, $100,000, something like that, in a specific line, and we'd have to write a policy. It would be very specific, and you'd have somebody in your office that have authority to be able to actually authorize the use in this kind of storm. If you have other ideas, I'm totally open to anything else. As I said, I'm just trying to come up with something.
That could run into millions if you start going over the county.
Well,
trying to do
that's the
that.
thing. Again, it would just be removal. So you'd only be talking about, because I think the total removal cost for the tornado in 2020 was like $917,000.
Yeah,
Right?
and that was labor and equipment and everything.
Yeah.
That was,
So you're not talking huge dollars, especially, again, the only thing I'm talking about is the removal. So I'm not talking about,
Right.
hiring crews to help people cut their trees up or anything like that. It's just removal. And with people, when you have a tree that hits your house, then your house insurance kicks in. And at that point, when you hire a tree service to take care of the tree through your insurance, they take care of the tree. So all that's gone. So I'm talking specifically about the people who lose just trees.
Right.
And because at that point, your home insurance doesn't kick in either. So you're kind of
Well, I'll ask in the
stuck.
morning, I'll ask Cindy too about it, if.
Okay, I've
doesn't
talked to
bring-
her. So, I've talked to her about, even, opening on a Saturday. Or we've talked about the idea is to, okay, well, how much does it cost to buy a chipper from a county perspective? And maybe we have a chipper or two and we have them at convenience centers. Well, because of fire issues and regulations and so on, I think that's not a possibility to do something like
Yeah, that'd
that.
be-
See, so I, like I said, I kept hitting all these roadblocks with every idea I came up with, trying to figure out what can we do to make this easier. It's what
do you have
seems to
any
be,
wood mills around other than Grant?
yeah,
There are loggers that do this for a living.
okay,
You can get on the internet and find some of the sawmills, and nobody's one up out of Food South Carson, Gordonsville, or if you talk to them, they probably know people that do logging and haul stuff in, kinda like Blakesley, they get a big party. They don't get it all, they don't get all the limbs, if they get
right.
30-foot of trunk out,
That gives us
As much as
something.
it goes, but if you know the sawmills, they'll tell you who's
Right.
logging and feeding material into them, they may be
I got
able
an
to
idea now.
say, hey, come get this log cut out, so
Right, yeah.
that's an idea.
Yeah. So, maybe it's something we kind of work together and even put together just a plan. So that way,
I've got an idea.
as this happens more and more, at least that way we have, okay, so if this happened, then first we can call, these
Right.
logging companies. Then we can call these woodworkers. Then we can, and at least we have some resources to try to help people. So I just wanted to bring it up and see if we could come up with something. Because again, I know it's affected my district at least twice in the last two-ish years. And I know it's hit other people too.
Right.
And especially when you only live in the county, you don't have city resources for public works. It's just something I think that we should try to help our citizens with.
Lakehead.
But yeah.
Yeah, so he mentioned loggers. Of
Mhm.
course, they have chippers. These
Right.
tree service companies are throughout the county.
Yes.
We could possibly look at contracting with a group of tree service companies
That's
and
where I
just
was.
make a list. Okay, you're next on the list. You get the job if you want it. And then if they deny it, go down the list and just say, hey, we've had this come up. We have to have a line item, obviously.
That's where I was going with the line item. We'd have
And
to
then
bid it.
That would obviously be the I think the
So-
simplest solution to us not having to buy new equipment,
Right?
and we can just contract with somebody that would be willing to go do the job.
Well, like I said, that was my
But-
thought. If we split up a line item, then that's what it would do, is it would pay for something like that.
But it
Again,
would
we'd
have to be a specific.
right, we'd have to bid the
situation.
surface, and, you know, from the finance side of things, you'd have to bid it.
Yeah.
Then we'd have to work with EMA and actually come up with a policy
Yeah.
and make it very specific, and then make them, somebody, Joey's making faces at me, but,
Could,
yeah.
does the mayor have authority to declare any kind of like a small emergency?
I think I can help you, I hope. Mr. Murphy will, if we have localized areas where we have a lot of trees down at one time, we can work with him or the National Guard to get him to bring it out to the road, and Cindy will waive it and we'll take it to the landfill. In other cases, we've taken, if it's in local areas, we'll reach out to Frankie Neal, and they'll take dumpsters over there, and Regina Gert will take her group, and they'll go fill those dumpsters up, and he'll take them to the landfill, and we get Frankie paid for with the Middle Tennessee Foundation, whatever that group is, that has money, and they pay for that. That's another way we've done it.
Okay.
But I think the other thing, if you get into the chipper business, then the question
Yeah.
has come in our office many times. Okay, well, grandmama's tree falls on her well. Okay, well, are you gonna come take care of it? Well, no, I don't have that, ma'am, I can't do that.
Right.
And then what is a disaster? And then how far do we go? And it's kind of like the loss of the people that fussed about so-and-so's yard grass being knee-high. We go to court and we get the money to go
Yeah.
to mow the yard, and 6 weeks later, they say, you gonna come mow it again? And so there's some things that we
Oh, I
can't do.
agree.
Counties don't have public works. That's
Right.
just, but I mean, if your situation is local, just
Mhm.
if you just give me some time, we can help get that taken care of. But I don't know about, I mean, I think if you get into business, you just have to figure out, okay, well, is everything a disaster?
Yeah.
I
it's
mean,
gonna
Right,
be
as
a
I
mess.
said, I
Yeah.
mean, you'd have to,
Yeah.
it's opening a door,
But if you,
and I get that, so it's just trying to figure out how do we,
That's true.
and I don't know if it's a door we want to open necessarily. So that's, that's again why I wanted to have the conversation as to, okay, we have this problem. It's like a recurring issue. So maybe we could work together to come up with
Yeah.
something.
holler at me tomorrow and let me know where it's at, and we'll work at it.
Okay.
Okay.
So,
Yeah.
Perfect.
thank you.
Anybody got anything else? Need one more motion?
Motion to adjourn.
Adjourn.
Yep.